Hey, it's Dr. Centeno, and today we're going to talk about stem cell therapy for back problems. So, can stem cells help back problems or back pain? The answer is yes, but there's a couple of caveats. In the right patients, and if the cells are living and not dead, and if the doctor knows how to place those cells via imaging guidance exactly where they need to know, and if the doctor injects the whole functional spinal unit rather than just one part. So, as far as stem cell therapy for back problems, the right patient is someone generally who has back pain caused by a disc tear, meaning they've got pain with sitting, or somebody who has failed PRP in the low back. PRP is where you take the patient's blood platelets, you concentrate those blood platelets, and you inject them back. And many times PRP will work just fine, but when it fails, that's generally when we will use stem cells in patients who have back problems. And as far as stem cell therapy for back problems, this will work again, but the cells have to be living. So we see many clinics out there advertising umbilical cord and amniotic, quote, stem cell therapy, but there's no living cells in any of that stuff, and certainly no living stem cells. In fact, the only living stem cells we can use on your back problem would be those that come from your own bone marrow. So when it comes to stem cell therapy for back problems, you have to make sure the doctor knows how to place the cells into the exact right spot. All too often we see clinics that can only do simple muscle trigger point injections, and they're nowhere near the deep structures that need to be injected to make this work. That requires things like fluoroscopy or ultrasound guidance. So again, most clinics are not doing that at all. And to really maximize the potential from stem cell therapy for back problems, the doctor needs to inject the whole functional spinal unit. And this is the minority of the clinics out there. And again, this has to be done under imaging guidance. So that would be the superficial and deep ligaments, the facet joints if needed, around the nerve if needed, into the disc if needed. All of that makes up the functional spinal unit, and all of that needs to be treated, which again, rarely happens. So if you want to learn more on this topic or learn where to see an expert who knows how to do this the right way, go to Regenexx.com or Centeno-Schultz.com. We're in Colorado, and we were the first clinic on earth to do low back stem cell work, but we also have trained approximately 70 other clinics out there in the US that may be closer to you. So thanks so much for watching, and have a great day.